And I always say, and I mean this from the bottom of my heart, this is such an incredibly amazing community, and you guys are heroes simply for waking up in the morning and getting through your day and staying alive, choosing to live and fight. I hope that my message today is an overwhelming one of hope. Um, I am CEO of the Spiro Clinic in Fayetteville, Arkansas, and to date, I have treated just under 400 CRPS patients. Certainly, we're seeing a lot more now. It took a long time for our message of hope to get out there, but we are making a name for ourselves. And I think we have some incredible information that I'm so excited to share with this community. 10 years ago, I saw my first patient with CRPS. He came in with gastroparesis. He could only eat chicken broth at the time before he would curl up in horrible pain, and he had full body CRPS and was running out of options. And he was actually discussing suicide with his wife. They came in with his 9-month-old baby Sean, and his wife told me that I was his last stop before suicide. That was a massive burden on me because the first thought you have, of course, is what if I fail with this patient? And at the time, the main tool I had was vagus nerve stimulation. Lucky for me and lucky for Carlos, we did the first treatment, and that night he left my office and he ate a full meal. And that gave me this incredible gift of passion, because what an amazing gift to work with a patient who's at the brink of death and watch them 12 weeks later go into remission, get their life back, and is now still in remission 10 years later. We have so many patients that have gone into remission going through our program, and we certainly advertise their pictures and their stories and their videos all over our site and our Facebook page and our Instagram page. And so I'm here to tell you today that I think as a community, we need to move more and more to this feeling of hope. When you're first diagnosed with CRPS, a lot of doctors will tell my patients, you have CRPS, but please don't go Google it. And of course, when you get home, the first thing you do is get on Google, and you're hit with this incredible wave of despair, because the word out there is no cure, there is no hope. And I'm certainly not here to call it a cure, but we have patients in remission now as long as 10 years out. We have patients that have gone through our program that have had fractures, surgeries, massive trauma with no recurrence of CRPS. So in my office, we call that a white crow moment, as in you only have to see one white crow to know that not all crows are black. So what is it that we do? You know, how do these people attain remission? Well, our first philosophy is when a person walks into our office, we look at the whole body, meaning every single aspect of that body. So we start off with basic blood work, and Dr. Hanali Vandermeer, my sister, actually manages that portion of our practice. And something we have noticed in analyzing the lab work of hundreds of CRPS patients is that there is a very high incidence of chronic viral and or bacterial infections. The Epstein-Barr infection is probably the one we see the most, but certainly we see a lot of the other herpes viruses as well. And if that underlying infection isn't addressed, then the patient cannot recover. So we tackle that, and then we stimulate the vagus nerve. The vagus nerve is one of your cranial nerves, the 10th cranial nerve, that runs to your GI tract and pretty much all your internal organs. And it also controls your immune system and your GI tract and inflammation in the central nervous system. We have noticed when we stimulate that nerve, sometimes pretty much on the first day, patients' pain will start responding. Once we have that inflammation under control, then we can tackle it with some pretty focused physical therapy. When I say physical therapy, it's typically not the physical therapy you guys are used to. We use a special machine that uses a direct current to assist the patient's body so that each second on the machine is roughly equivalent of 250 normal seconds of doing the same movement. So we look for neurologic weaknesses with that system, and then we rehabilitate correct movements back into the patient's body. So every second on the machine, if you're programming the correct movement, now you're doing it 250 times per second. Think about the power of that. So often patients will watch other patients when they first come in, and they see them in a wheelchair 1 week, and then 4 weeks later, that patient is able to maybe walk 400 feet. And they'll wonder, why is this possible? How do you do this? And that's the technology that we use. We altogether use about 15 different treatments. And when patients come in, they've often tried maybe one or two of those. But I believe in what I call shock and awe, meaning exponential power, where one thing, if backed up by another therapy, makes the first thing more powerful. It's kind of like pulling a rope. When you're pulling by yourself against 10 people, you're not going to get anywhere. But when you have 10 people behind you backing you up, now you're exponentially more powerful. We also believe that the secret sauce is love and empathy and an immense passion for our work. We promote among our patients that they go through this experience as a group. So when you're sitting in our waiting room, you have patients in there with therapy dogs running around, patients are playing cards. We have patients ringing the bell when they graduate, and that's a community event. So we promote this sense of community so that one person's hopeful story can motivate another patient. I always say it's like climbing a sheer rock face, and you look up at this mountain and you think it's impossible. No one can climb this mountain. But you simply put in your ice pick and you drag yourself up, and then you drag yourself up higher until you peak. When you're standing at the bottom of that mountain and you're watching other patients scaling that mountain, it becomes possible for you. Our motto is Dum Spiro Spero, which means while I breathe, I hope. And that is the message I want you guys to have. Do not buy in to the concept that the rest of your life is going to be all about pain management and accepting your pain. You have to fight. There are stories of remission out there, and sometimes they happen all over the world. People achieve remission in various ways, and often they are so happy to share their success stories and their journeys. And you need to find these people, and that needs to be your white crow moment so that you can keep fighting as well. I want to open the floor for questions, because I know that very often when we go through this, I say a bunch of things and I talk about my treatments, but the on the ground questions are so important because they're questions that all of you have right now. So I have Kaylee helping me, and she's going to read off questions. Can you see it, Kaylee?
Mm-hmm. If you guys could go ahead and just start typing any of the questions you have in the chat, I'll be happy to read them out to Dr. Katinka.
While we wait for those questions, I want to say that I understand that pain management is crucial for you guys. I am never critical of that, but I think as a community, we can do better than spinal cord stimulators. We can do better than repeated ketamine treatments. We can do better than having to live with opioids. The nervous system, the central nervous system, is so crucial to your recovery. The central nervous system controls the recovery of complex regional pain syndrome, in my experience. And so supporting that system, rehabilitating that system is so very crucial to get you back on your feet. They are doing very interesting research in conditions like Parkinson's, where they now found that if you have infections, bacterial and or viral infections, it can live in the vagus nerve and it can travel to the brain and the central nervous system. And while it infects that vagus nerve, your nervous system is going to be inflamed, which is going to cause chronic pain.
Okay, the first question we have is, how specifically do you stimulate the vagus nerve?
So what it looks like is light touch on the cervical spine. It's funny, I often have patients get off my table the first time and they say, I traveled from Tasmania and this is all you did. I mean, it's just short, it's non-invasive, and we're stimulating the auricular branch of the vagus nerve. That is a patented technique that we just started teaching to other doctors for the first time in New York City this past January. So we're definitely starting to treat other physicians. The problem is that by itself, it is not enough to get patients over the hump. I developed my system over 10 years by always being obsessed with the 2 out of 10 people that I could not help. Because to me, it's not just a case that leaves and they leave my office and I forget about them. They haunt me. They drive me. That is what gets me out of bed in the morning. Those 2 out of 10 people. How are we going to figure out to do better, to be better, to get over that hump? So one of the big factors we have figured out will interfere with healing is hidden scar tissue. And when we say scar tissue, you guys think of a scar that you can see on your leg or your arm, but the scar tissue may be internal. The scar tissue may have formed around a spinal cord stimulator, or it's an area in the body where the nervous system isn't communicating. So you have to normalize that tissue so that the nervous system can flow through it and reconnect. It's all about reconnecting the central nervous system with every single cell in your body. And that was a great question. So thank you for that.
Awesome. Okay, next question. Is there an overlap of autoimmune conditions and CRPS?
Definitely, we see that a lot. Now, I don't have all the answers, guys. I know how to read the tea leaves, if you will, but we noticed that a lot of CRPS patients will also have mast cell activation. They'll develop rheumatoid arthritis sometimes and other autoimmune conditions. They tend to be very sensitive to different foods. And so I think it's my guess, my hypothesis that the central nervous system breaks down. And since that is ran by the nervous system, the immune system breaks down too. But I do know that once you rehabilitate the central nervous system, the immune system also improves. Another hypothesis that I have, and I just want to throw this out there, and this is purely a hypothesis now, we see such a big overlap between Ehlers-Danlos syndrome and complex regional pain syndrome. And then CRPS patients that have cold limbs, hot limbs, easy bruising, they're definitely very difficult to draw blood from. Our phlebotomist always says in school they warned her against that 1 or 2 crazy difficult draws that you'll see per year. And she said, when I came here, it was every single draw. So we believe there is a big overlap with the vascular system and a genetic factor and complex regional pain syndrome. But having bad genetics does not mean that you cannot recover or rehabilitate, in my experience.
We're getting some really good questions, guys. I apologize. I wasn't planning on being on camera, so I'm in athletic wear. I'm not going to read this entire question, but basically Joe is saying he's been experiencing CRPS in his esophagus and feels like he has a very unique and complex case. And so the question is, are you confident that remission is possible for everyone?
You guys, I can, of course, not promise that remission is possible for everyone. That would not be the truth in my experience. And the first day that I sit down with a patient, I tell them, you are paying me and my staff to fight for you. I cannot make a promise of remission. What I can say is that we've had some very off the wall cases, people with CRPS maybe in their face or burning mouth syndrome or their pelvic areas, full body cases that have seizures, and very, very difficult cases can respond. I am confident in the body's ability to heal itself from within if it's able to function again. I don't heal a single patient. The doctor that really is going to heal you already is inside of you. It is just our job to get that doctor back on its feet so it can do its job. Healthy people do not develop CRPS. I notice with patients that they're so focused on the accident or the surgery that started it, and they want to go back in time if they can only turn back the clock. But I always say it was the perfect storm. And if it wasn't one thing, maybe it would have been the next thing. Your body was sick, your central nervous system wasn't functioning well, and then you got CRPS. It was just the straw that broke the camel's back.
Awesome. Next question. Um, a little controversial. What's your opinion on spinal cord stimulators? Do you think they are harmful in the long term? And do you recommend that they be removed?
Um, Let me just say, I understand if anyone feels the need to get a spinal cord stimulator or if they've had relief from spinal cord stimulators. And I certainly do not want to minimize that because I know what kind of hell you guys go through. That being said, we have seen terrible side effects in person. We are now treating a young girl in her 20s from Texas whose spinal cord stimulator had a leak. The battery leaked for over a year in her body, and she developed burns on the outside of her body. Pretty universal is the fact that scar tissue will start forming around the leads. And in my experience, if it works very, very well, it will give you some quality of life back. It will not restore your full quality of life. To me, a win is remission. And people often ask me, what does remission look like? And remission is not being wrapped in bubble wrap or taking pain meds for the rest of your life or being dependent on this device to interrupt pain signals in your body. To me, a win is being able to ride a horse again, being a volleyball player again, being a gymnast again, being a cheerleader again. These are all real things that our patients have accomplished. When you have a spinal cord stimulator in your body and you do go in remission, in our office, we do recommend that you get with your doctor and get that removed. So most of our patients that go into remission do choose to finally remove those.
Perfect. Someone is asking a question if you have a published paper on your vagus nerve stimulation. So can you talk a little bit about research?
Yes. So we're very excited. We are doing our first formal study through Kent State University. We just started with the preliminary recruitment and things like that to launch that study next year. What most people don't realize about studies is that they are tremendously expensive. Thank goodness we had this break where a PhD candidate came through my program and went into remission, and she's the one driving this research study now, which is going to be so valuable. But still, we cannot study our whole system because it's not allowed. They will only allow us to start one treatment at a time, and we chose the vagus nerve treatment. And then we'll get published because I'm confident that we're going to have a tremendous outcome from that. And then they'll allow us to add one more therapy. So it will be years before we can even study our whole system together.
Perfect. Sorry, one second. I'm just scrolling through, guys. Someone wants to know if we are offering any sort of virtual treatment since COVID has happened.
So Dr. Hannah Lee does a 2-day consult. She's the one that analyzes your blood work. And I believe we're still doing those. And we have a link for that on our page, I believe, right, Kaylee?
On the new page.
On the new page. We're launching our new website next week, and we're very excited about that. And it will be www.thisperoclinic.com. So you can book that appointment there. But I want to just throw caution out there, you guys. Our system, for maximum improvement and really to make a shift, the whole system has to be used together. Now, we've had one patient, she was a pediatric patient from Mexico City that went through Dr. Hanadi's program and did achieve remission, but that was a one-off. So that system is fantastic. It will help, but it's not the whole answer.
Awesome. Next question. What is the typical treatment time in our program?
So our average patient graduates from our program after 12 weeks, which is a long time to live out of state or in another country. But a lot of people actually love Arkansas once they're here. I think our little town surprises them. It's a really good place to live, and a lot of our patients have relocated here. So it is a 12-week program, Monday through Thursday, pretty much day in and day out. It's full day. It's a very busy day filled with different appointments. And then we give 3-day weekends so that you can rest. Also, a great question.
Awesome. Have you noticed a higher number of CRPS patients by demographic or region in the world?
No, I do definitely see more females than males, but we do see our share of males. I find that our patients are getting younger, but I think part of that too is that our medical community is getting better about recognizing this earlier. We had an orthopedic surgeon contact us today. The patient just had surgery, shoulder surgery, and they noticed the signs of CRPS right away. So I think our um, our groups like CRPS Forum and RSDSA are doing a great job of getting the word out there and educating the medical profession as a whole.
Awesome. Next question. Great question. Are there any other clinics doing something similar to what we are doing?
Thank you for asking that. At this point, I can confidently say, since I'm the one that has developed this over 10 years, that unfortunately we are the only clinic offering our system. The reasons for that, I have so many, but it sounds selfish. You know, why do you have this great answer and you keep it to yourself? Why aren't you sharing it with other doctors? And it's a complex system. You know, these 15 different treatments involve very expensive equipment sometimes, but the equipment is just that. It's like a scalpel. When it sits on a table, it's useless unless it's in the hands of a highly trained individual. And my staff members, I've handpicked over time. Some of them work with elite athletes. Some of them had great physical trauma themselves. We pick them for their passion, and then we believe that we can train the skills into them. And then they have to train on the ground next to existing staff members for many, many, many months before we allow them to be on the floor. So to take that system and put it into another clinic is going to be quite the undertaking. And at this point in my life, I have 4 very young children. And so that's a lot. We're expanding our clinic right now. We're tripling the size of it in the next 2 years. We will be able to handle 3 times the amount of patients we handle now. And then certainly our next step is going to be expand into the next clinic and eventually into other countries like Australia. We see a lot of patients from Australia.
Awesome. I think we are just about done on time. I'm seeing a lot of questions about specifics of our program. I just want to tell you guys, I will post our website link again in the chat. If you have questions about our program, what we do, where do you stay, you can fill out that contact form, or our phone number is on our website. You can reach our patient care coordinator. Her name is Anna. She's fantastic, and she will be able to answer any of those questions you guys may have about our program.
I just want to end by first thanking CRPS Forum for this amazing opportunity and thanking you for all the wonderful work you're doing in this community together with our other physicians that are fighting so hard for you guys. And then I want to say one of my favorite quotes is, "You never know how something you say, do, or think today will affect the lives of millions tomorrow." So the way you think about your future is crucial. There is a poem, and I forget who wrote it, but it says, "What is it that you're going to do with this amazing, great, wonderful life of yours? Where are you going? You're not just surviving, you're not just struggling to get through another day. You don't just have to manage your pain. Other people are doing it, they're getting their lives back, and you have to grab onto hope. Even if you have 0 hope today and you can work yourself up to a 1 on the 10 scale of hope, that is so much better than when you are today. So find these stories, find these people, change your mindset to a mindset that recovery is possible. Your body is awesome. It was created in an incredible way. It's very intelligent, and it is still there to fight for you. You're alive for a reason today. Thank you so much for your time and for connecting with you guys. It was my absolute honor.